guys. I would like to talk to you today a little bit about the preoperative assessment of the surgical patient that is performed by the preoperative nurse. So just as a broad overview, before we get into the lesson a little deeper, the goals of the preoperative assessment are to prepare your patient for surgery while looking for issues that would make surgery risky, like comorbidities or issues with the patient's mental status. Remember, the preoperative nurse will be the one completing this assessment, and as the preoperative nurse, you will want to pay special attention to any specific or special needs that your patient may have. So, special needs could include things that relate to your patient's culture or religion, or any specific physical or psychological need that they may have. Also, a super important part of the preoperative assessment is to share information that you gather, like test results or critical values, with other members of the perioperative team. Perioperative nursing is a team approach for sure. Team, team, team. And one last goal would be to begin the planning process for the patient to go home or be discharged. So, of course, with the preoperative assessment, you're going to always identify your patients. You're going to complete vital signs and a pain assessment. And you also might do things like diagnostic testings that could include x-rays, blood sugars, pregnancy tests, which are pretty important to surgery. A patient's age, although it may seem obvious, is definitely important to assess because, as you can imagine, if a patient is a baby, there are going to be different requirements in surgery required or needed than a patient who is older. A super important part of the preoperative assessment is making sure that the informed consent is complete. Check out the lesson that we have on informed consent for more details. Okay, so also guys, with the preoperative assessment, a thorough patient history is super important. When we talk about history, we want to ask the patient about their medical, surgical, and social history. We can find out a great deal of information that will be important to the surgery, and if the patient is at risk for any issues during and after the procedure. We need to assess our patients for any cognitive issues that they may have, meaning they should be able to describe and understand what they are having done. If this is not the case, there may need to be a surrogate decision maker present. So, medical issues or chronic diseases, things, for instance, like diabetes, they can delay the healing process, and previous surgeries could also be risky if the patient has had any issues with anesthesia in the past, like malignant hyperthermia. Now, check out the lesson that we have specifically on malignant hyperthermia for more details. If the patient has a history with substance abuse issues, maybe smoking, alcohol, drugs, all these things can delay healing times. They can create breathing issues during surgery and also increase the anesthesia needs. So those are important to assess. Be sure you check out the lessons that we have on the different types of anesthesia for more information. So, if you've had surgery in the past, I'm almost certain you have been told nothing by mouth, or it's going to be the NPO status after a certain time. So, aspiration during surgery because of anesthesia is a huge concern we have in perioperative nursing. So, assessing this in your patient is super critical. You may think this is an easy task, but probably at least once a day where I work in surgery, a patient will have their surgery canceled because they ate maybe barbecue ribs for breakfast. And I am not kidding, that really happens. So that's important to assess in your patients. Allergies are another very important assessment when it comes to surgery. One that we pay very close attention to is latex. If a patient has a true latex allergy, this can cause a load of issues for the patient. And guys, keep in mind that certain foods like bananas, kiwi, and avocados are said to be associated with a latex allergy. So keep an eye out for patients with these allergies. Because we do use medications in surgery like local anesthetics and antibiotics, we need to know what medications the patient is allergic to also. And finally, be sure you assess in your patients or ask your patients what medications they are on and when they last took them. Meds like aspirin and anticoagulants, they can increase the bleeding risk in the patient. And don't forget to ask about vitamins and herbal supplements. Patients do not often consider these medications, but they can cause bleeding issues too, so ask them specifically about those. So guys, we also need to know if the patient has any metal implants. This is because during surgery, we use electrocautery. And this is a device that is used to cauterize, or in other words, seal a vessel closed and stop something from bleeding. So with this, a grounding pad must be used, and it can't be placed over a metal implant, which can cause a burn in your patient. And we have no time for that. So also, your patient's weight needs to be assessed. We will pay very close attention to extremely low BMIs and very high BMIs. Both can increase complications in the patient. They can have issues with temperature control, anesthesia needs, and they can increase postoperative complications. Another important part of the preoperative assessment is checking out your patient's skin. What does it look like? Do they have any bruises, cuts, scrapes, abrasions near the surgical site that could prevent the surgery from happening? Oftentimes, if the patient is having a surgery where implants are involved, like a total knee or a total hip, something like an abrasion can cause the patient's surgery to be canceled. Also, guys, a lot of patients are going to have some type of sensory impairment. Hearing issue, maybe a vision issue. Patients who wear contacts, they should remove them, as these can cause corneal abrasions when they are under anesthesia. And with things like glasses and hearing aids, we need to be sensitive to the fact that these devices, they can increase the comfort or the mental status and support our patients, especially elderly patients. But we also don't want to cause them any harm to the patient, or we don't want to lose any of their belongings. So always check with the provider and or the surgeon if a patient feels super strong about keeping contacts or hearing aids in. And last but not least, we want to check with the patient to see if they have any family support with them for during and after the procedure. Okay, so with patient education and the preoperative assessment, we really want to encourage our patients to ask questions. We also want to, in the most comforting way possible, encourage them to give us information and to be truthful. What we don't know could definitely hurt them. So finally, let's encourage our patients to express any needs that they may have. So when we think of the different nursing concepts that pertain to the preoperative assessment, we definitely think clinical judgment, because we are assessing our patients for risk factors to surgery. We think about patient-centered care because our main focus is the patient, and most definitely safety, as the preoperative assessment has the main purpose of keeping patients safe. Okay, so a few points to wrap this lesson up. First, the goal of the preoperative assessment is going to be to prepare the patient for surgery and identify surgical risk factors. A complete patient history will be assessed, which will include things like their medical history or chronic conditions, surgical history, and psychosocial history. And we're also going to focus on their current status, meaning their age, BMI, MPO status, medications, allergies, vital signs, and completion and full understanding of the informed consent. Also, any patient impairments should be assessed, including skin, hearing, vision issues, and let's not forget about their cognitive issues. They must know what is going on. And finally, we're going to assess their discharge plan or concerns, meaning is family support available and what follow-up should include. Okay, guys, I hope you enjoyed this lesson on the preoperative assessment of a surgical patient. Make sure you check out all the resources attached to this lesson, as well as the rest of the lessons in this course. Now go out and be your best self today. And as always, happy nursing.